Welcome everybody, I'm Dr. Ryan Weaver. Today we're going to be talking about something very controversial, and fibromyalgia is that topic. So you may be a little familiar of fibromyalgia and some of the symptoms that are most commonly muscle pain. Yes, classic definition and diagnosis, 11 of 18 points throughout our body with extreme pain, not just muscle tenderness, that gets you the diagnosis of fibromyalgia. But let's really dive into this tonight. So once again, I'm Dr. Weaver. We do these spinal workshops every Tuesday evening to go ahead and educate our community, our patients even more, because if I can't directly help you, even through education, if you're not patients in our office, hopefully it helps you live a better life. So today, fibromyalgia, if you don't have it, you're gonna learn that the better you are before a possibility of even having it, or the onset, the easier it is to restore function and recover completely. So who's really affected by this? Well, 80% are women, 20% are men, and about 12 million of the US population deal with fibromyalgia. So I'm gonna pause on this. As you heard me mention, it's easier to deal with if you were in better function before a diagnosis. Well, we could really argue this for any diagnosis or any ailment, symptom, or disease that you have. The stronger, healthier you are and thriving before anything happens, traditionally, you jump back faster from it. Take surgery, for example. If you're more fit, healthier, yes, the younger you are, the easier it is to jump back from things like that. And such is true with fibromyalgia. So people with fibromyalgia are 2 to 7 times more likely to deal with depression, anxiety, headaches, IBS, chronic fatigue, lupus, and RA. Chronic condition means there's no cure. Instead, treatment involves coordinated management to alleviate symptoms. So the most common symptoms you heard me mention earlier, extreme pinpoint pain to 11 of 18 areas over our body, but also that could be worse is fatigue, sleep disturbances, body pain, and paresthesia. Over 90% of people or patients report having low back, neck, and shoulder pain. So with that in mind, we have to understand that pain, that sleep disturbances, anxieties, depressions, all of these affect different organ systems. The one system that directly affects every one of those, our nervous system, so we need to make sure that our body is communicating with all of its other systems appropriately. So a cool study from the University of Alabama, a little tied there, the underlying cause of fibromyalgia may be the reduced blood flow to parts of the brain that process pain in twice the normal levels of a brain chemical called substance P, which helps the nervous system cells send pain messages to the brain. Serotonin deficiency is one other hypothesis and may explain some of the observed findings. Serotonin is a neurotransmitter whose whole role is regulation of deep restorative sleep and the interpretation of painful stimuli. Tryptophan, you all hear that around turkey time, is an essential amino acid and it's the metabolic precursor of serotonin. So possibly a serotonin deficiency or abnormal levels of substance P. So what are things that you need to understand about fibromyalgia? Well, the first thing is, as I mentioned, extremely sensitive, painful points throughout our body, not just tender. So, from Nobel Prize-winning scientist Dr. Roger Sperry, stated that 90% of your brain's daily activity, so back again to our nervous system, daily activity is involved with positioning your body against gravity. Poor posture in the presence of gravity makes for a terrible and tiring degenerative combination. So the combination of poor posture wears on our body, that our body's working overtime to correct that. And it's wearing and wearing and wearing our body down, and our brain activity. Therefore, to eliminate compromise of our nervous system, therefore all other organ systems in our body, as I stated previously, spinal posture is in every point of our daily life critical. Now, if you're in my office, you hear me talk often about, well, that forward head posture, we're slouching. We talk about that in multiple spinal workshops. And a lot of this comes back to the simple fact that our posture is important and that our nervous system communicates everything through our body within other organ systems. So with fibromyalgia, and as I stated earlier, the healthier, more active, more fit, and functional we are prior to something like fibromyalgia, the better chances we have. But this can become a chronic downward spiral in that, well, if we have muscle pain, we probably don't want to move a lot. Well, if we don't move a lot, we're probably going to get anxious, depressed, still not wanting to do anything, which means more or less of activities that we enjoy doing. Then we end up with some medication. Then that by default has some other side effect that we could end up with more challenges, both mentally and physically, more muscle pains, more medications, and that just continues to go around and around. So, what are the things that we can do? Well, number one, you hear me talking about posture. So obviously have your spine checked. Make sure our spinal curves are how they should be. We're in good alignment. So always check that, number one. But in terms of things that you can supplement with, B1, this is a good energy vitamin. B6 is essential protein for neurotransmitters and neurotransmitters. B12, which I personally take. This is for energy and protein metabolism. And here's some other ones you're probably very, very, very familiar with. Calcium, iron, and potassium. All of these help with energy. Magnesium is another one. So how about things that you can eat? Well, shocking, fruits and vegetables. Eliminate sugar, caffeine, and artificial sweeteners. So a big pause moment. Back to a few of our nutrition talks. Eliminate sugar, which when we talk about sports drinks, how much sugar is in those. Caffeine, again, I'm a caffeine drinker personally, but do not become dependent on it, because maybe it was 1 cup a day, then it was 2, then it was 4 and 8, and it continues to raise that threshold. The last one, artificial sweeteners, another one that we discuss a lot about, and dairy products there. So we see more and more people who become allergic to dairy products. So again, things that you can try and eliminate. So all in all, and this is probably one of my biggest talking points to most of the patients who have that diagnosis or may think they have it, is healing takes time. The American Pain Society and Fibromyalgia panel recommends years of effort, not only relieving symptoms, but also changing the patient's attitude and education about the disease. So once again, regardless of if it's fibromyalgia or arthritis, we talked about that last week, continue to educate yourself about these things. So, years of effort. This is going to take a very, very long time to help heal. Have your family members understand this. They need to be involved to understand short-term goals. That if you couldn't walk 100 yards, that just going 10 yards in a day is a big win. And maybe it's 2 weeks and then you get 20 yards. But something as simple as that can have a profound effect. The willingness to work beyond pain, so back to our mental aspect of this, is also setting realistic expectations. Again, kind of like just walking or going up and down stairs, whatever that is for you. A combination is needed of responsibility and control over their own outcomes. Again, I can only do so much for you. My team can only do so much for you. You have to be involved. The more that you are involved and you play in the game yourself, the best outcomes. And at the end of this, there's hope. There's hope for all sorts of things that most people just kind of chalk it up and accept it like, well, I have this diagnosis. It's terrible to deal with and live with. So understand there's hope. There are places that understand this and that can improve your health without medications and surgeries. But again, you have to challenge yourself. You have to commit to those things, and you have to say, you know what? I want help. I want a positive outcome, and I don't want to use drugs and surgeries. Again, God made a very, very, very good system that we're blessed with. But sometimes we need to really self-check ourselves of how are we taking care of it? We only get one body. Are we eating poor foods? Are we not getting our rest? Are we not exercising? What is that for you? But yet we still demand great outcomes out of our body's performance. So, again, there's hope, there's light, there's joy. Again, have your spine checked. I thank you guys for being on here today, and we'll look forward to seeing you at our next spinal workshop. Take care. God bless.